Edna Navarro-Vidal, and I'm the Assistant Director of Community Systems Development at Illinois Action for Children. On behalf of Illinois Action for Children and the Consortium for Community Systems Development, we would like to welcome you to today's exciting webinar discussing how local collaborations can engage family perspectives. Today we'll share some examples of local efforts. Today's agenda includes an overview of what we mean by engaging families' perspectives, examples, a question and answer session, and some resources. To get us started, here are some housekeeping tips. This session is being recorded and will be available later on our website for viewing. All of the participants have been muted until the question and answer session. If you encounter technical issues, please use the chat box to send us a message about your technical issue, or feel free to email Carla at the email you see on your screen. At this moment, and get us present for today's conversation, I would like each participant to briefly introduce yourself, and the role that you have in the community. Are you an early learning program? You are CCR&R, social service provider, etc. And currently we have about 8 attendees. So if you would please share your name, your community, and your role. Thank you.
Hi, my name is Jackie Farber, and I'm in Urbana, Illinois, and we serve 6 different counties at Child Care Resource Service, and that's what we are, an R&R. And I have several roles in the agency that I do, but one of them is community systems development. Thank you.
Thanks, Jackie.
Hi, this is Joanna Sue with the Governor's Office of Early Childhood Development. I work on cross-systems initiatives.
Hi, Joanna. You've all been unmuted, so feel free to introduce yourself. Okay, so we're going to move on. We'll have another opportunity to hear who's on the phone. Now we'd like to invite you to participate on a poll. Please answer the following question. How do you typically engage family perspectives in your efforts? Are they at the ignored level? Are they at the recipient level, the consultant level, partner, or change agent? As you think about which answer fits your community's efforts, please refer to the bottom half of the slide as far as the definition. And go ahead and submit your response. Once everybody's response is in, we'll show the results. Okay, a little bit of over half of you have submitted your response. Let's get a few more in there. All right, we're almost at about 90%, so all of you have almost submitted. Thank you so much. Okay, at this time you see our results. Great. It's great to see that a lot of you are currently partnering with your families. We just wanted to make sure to get a sense of where people's experiences were at as we continue the webinar. Thank you for participating. Okay. At this time, we would like to talk about the what, the why, and the how. First of all, we would like to define what we mean by engaging families' perspectives. Typically, we create strategies to leverage the child's family as their first teacher or as their child's expert. And we'd also engage them through as program participants. Through our current systems change efforts, communities have been building on those strategies to include parents in providing opportunities for them to share their experiences, also providing input for decision making on issues that arise, and also being active in creating community change. Now that we understand what it is, let's talk about the why. Basically, the why boils down to that by engaging families' perspectives, it helps the community stakeholders identify and address the targeted issue. It also helps to more effectively design the strategies so that the efforts can achieve the community goals. There are many ways to engage family perspectives, and we referenced a few earlier. Here are various opportunities families can share. They identify the issues, they help to design strategies, they are part of the implementation of the strategies. As they are out implementing the strategies, they provide a learning opportunity and feedback. And again, they are also part of creating the community change. Here to share how local communities have engaged their parents is Leah Powell, Director of Community Systems at Illinois Action for Children. Leah?
Hi, Edna. Thank you, and thank you for everybody for being on the call today. We're really excited to be able to share some of the findings from the Innovation Zones in terms of what they tried for family and community outreach related to enrollment. Some of the strategies that were tried with Innovation Zones included community engagement, use of technology, going door-to-door canvassing with parent ambassadors, or in some cases they had hired what we called mother advocates, connecting families who are engaged in home visiting programs, mobile pop-up preschools, and engaging family voice. A lot of the Innovation Zones reported that their participation in the project changed the ways that they communicated with their families. They also found that they had less time at their desks and more time out in the community building relationships. We found that a lot of the Innovation Zones had stated that in their work, families often had limited awareness about what opportunities for early learning were in their community, and also limited awareness about how they could access those opportunities. So these different strategies that the Innovation Zones tried seem to be able to make a difference. Go on the next slide. We had one quote here. This actually came out of the evaluation. So the Innovation Zone project was recently evaluated by Southern Illinois University, the Illinois Education Research Council, or IERC. And that's going to be available, I guess, on the Partner Plan Act website by the end of the month. We'll put that up there so you can read that in full. But this is just a sample of what they shared from the evaluation. So our goal primarily was to make it very easy for families to enroll, and also to make preschool programming really accessible, and to try to take some mystery out of it. What they did with Innovation Zones is this idea of getting outside of the building and not staying inside with your coalition, or not staying inside with your coordinating team. What they did is they got outside and they talked to families, and they asked families about what types of obstacles they might be experiencing in terms of connecting to early learning programs or enrolling in early learning programs. From those conversations, they learned that preschool could sometimes be hard to get there. And by having conversations, whether that was one-on-one, answering questions, taking them there, accompanying families to enrollment sites, helping them fill out applications, that really seemed to reduce obstacles. Like I said, so what they found out, they did that by asking, saying what's hard, and then also not stopping there, but saying what would make it easier for you. Really taking the time to get to know the families, to not make any assumptions, to think from a systems lens, not jump to solutions, but really dive deep and let the families explain from their point of view what might be a great solution to help them. The next slide. Another community innovation zone said, I would definitely say that outreach has made the biggest impact. There were so many families with young children who were not connected to any early learning program. And those of us who are part of our innovation zone knew that if we targeted places where families were, then we could make an impact. And we definitely did. What's important here is that the innovation zones really took the time to foster new partnerships and to combine their work with families with other strategies that they were doing. So, for example, they made a list of all of the families from priority populations that were identified for targeting for the Innovation Zones project, and then looked to understand in their community where those families might be receiving services. So, for example, if you had veterans in the community, they could work with an organization that was serving vets and their families. If they had families that were in child welfare systems, then they would go and build relationships with someone who worked in the child welfare system. Same thing with homeless shelters, public housing developments, and also just working with home visiting programs. So what they found was that by going directly to where families were, that helped to remove a barrier of families having to go to a school or to a child care center for an enrollment site. And again, they really learned that by planning with families. So as you know, with innovation zones, they were adaptive and iterative, so thinking from a systems lens, but also using small experimentation and trying something and testing it out, getting some data to figure out what worked and didn't work. What was really important, and I don't know that I could do justice to how they explain this in East St. Louis, but it was nothing for us without us, I think was a nice quote that they had. So what East St. Louis was very thoughtful and conscientious about doing was to make a plan for families, but with families at the table, with families contributing. They learned so much about the work that they were doing. Cicero was another one, and Elgin. They both tried kind of this pop-up preschool or sample preschool idea, and that really came out of the learning that families, they really want what's best for their child, and they would state that, and then they would share how hard it was, whether they had lack of transportation or some type of uncertainty about what to do next. And so by offering a pop-up preschool or preschool in the park, they had a curriculum, they had almost like a play and learn where it could be a nice safe space for families to be able to engage with their child about the early learning experiences. When they were in Elgin, what they did that was very unique is they partnered directly with the school district and the public housing development. So their preschool in the park took place at the public housing development where they had the summer food program, so they had the lunch delivered, and then the school district was also there to enroll people on site. So you had kind of a one-stop shop, making it, again, very easy for families to connect and engage. In East St. Louis, what they did is, in North Lawndale, and I would also say in Pilsen Little Village, just to share some examples, is they heard from families and from the partners about how to do outreach and what they needed to do outreach on. And then they created some materials to be responsive. So, for example, families didn't know the difference between Head Start, the difference between child care, the difference between Preschool for All. And so a one-pager was created to help give an explanation of that. Well, they created it and then shared it with families directly to see if that actually made sense for families. So rather than taking the time to create a document that was still in the language of kind of administrators or policymakers, what they did is they helped to put it into language that families could understand. And then in another example, East St. Louis created a strategy where they were going to be engaged in the community for an outreach and enrollment activity. And the families were really the first point of contact, so that as a new family was coming up, they would see maybe a familiar face rather than having another outsider, a policymaker, or some sort of an administrator where they might have felt a little bit intimidated by that person. You know, they had shared that experience. And so it was a family who was able to give information in a way that they could understand. When they had problems actually with people, they had low attendance and low turnout for one of their events. It was the parents who suggested the places to go. It was the parents who suggested how to adapt and to improve their outreach efforts. And then in a third example, what we had in terms of making it easier was in Alkeld, in Riverdale community area, one of the parents went through a training called Tiny Habits Coaching, and so she learned how to be what they call a Tiny Habits coach. So this idea that if you make it teeny, teeny, tiny, we can all set goals because they're all reasonable. You know, if something is too big for any of us, that could feel very challenging. It could be something that I might not follow through with. But what they did with their Innovation Zone resources was to invest in training this parent, so then she was able to hold groups with other families to help set small goals with the families in that community. And we'll go on to the next slide. So some of the challenges and opportunities that they experienced were that, so I'll just say this, so Innovation Zones explored a wide range of family and community outreach strategies to help raise awareness about early childhood services and the educational programs that were available in their respective communities. Several of the zones coupled these multiple outreach strategies, such as combining parent ambassadors with the pop-up preschool, and overall they felt that their efforts successfully increased awareness of available early learning programs. What they also noted was that the door-to-door outreach wasn't always effective, just as an example. They also shared the concerns about community safety, especially during summertime and at nighttime in the winter. And then also a vision for engaging families by the collaboration was not always clear. And then this idea of parents and as equal partners is an opportunity. So to go a little bit more deep on what the door-to-door not always being effective, what they found is that you could go door-to-door and we'll say go to 800 doors, but not every door is going to have, one, someone at home. Two, once you find someone at home, they're not always going to have a child at home. That child, if they do find one at home, might not be 0 to 5. If that child is 0 to 5, they may already be in a program. Those who are not in a program may not be interested. So they tried it. What they did like about the parent engagement and the door-to-door outreach was that it put a presence in the community and it really did help build relationships. So it's not a strategy to discount. I think that a lot of people really still find it valuable to go to places where families are, that there is something to be said about being present. And you know, once you find a family and you know that they're there, our parent ambassadors would go back to the same house. They also found that with our attendance outreach program in North Lawndale, that the relationship building and the feeling that someone is coming to me was very comforting. It created a sense of trust, a sense of credibility for the organization, but recognizing that there are some limitations in terms of the impact of what door-to-door outreach can do. We would also say that in terms of family and community outreach, that just having tables and flyers and being in a place where families are already connected and just handing out flyers, again, is probably not going to be enough to help connect the engagement with an enrollment. Helping families complete applications, having conversations with families, and really spending time, we found that that was also very valuable as well. So flyers are helpful for giving information, but it should be a yes and strategy where I'm doing a flyer and I'm also having a conversation. In terms of community safety, our Innovation Zones did some peer learning together to help talk about that as on weekly calls. So what strategies were you trying? One of the organizations actually had a community safety training that was sponsored by her home organization, which she then brought back and shared with the other Innovation Zone communities. So as our summer months kind of ramp up, or even in the wintertime when it's darker outside, it's really worth having strategies in place as an organization to have policies that you can turn to, whether it's a call tree or something like that, just to ensure the safety of your people who are going out door to door. On the point of visioning for engaging families was not always clear. So a lot of times our Innovation Zones, especially at the beginning, would kind of jump in with an idea and think about, okay, well, we could just get families to work for us, and then maybe they wouldn't pay the families, not thinking that that meant something. And then realizing as they were doing the work that the value and dignity of work and that everybody who's doing work deserves pay really evolved and became a clear need for a lot of the communities and for the families that they were working with. So it was really treating parents as equal partners and engaging with them in the work that they were doing for them and with them, and really treating them as employees if they were being treated like employees. Letting families know, having voice, so not just sitting at a table and assigning work to families without their voice being part of that conversation. So nothing for you without you, kind of back to that idea. So, a lot of times people have good intentions and they don't realize that they're leaving people's voice out. And it was really through the experience of having a table for family feedback and for people to weigh in and give almost a critical feedback to the Innovation Zones is actually quite helpful, and it's a really important part of reflection. It's an important part of growth, so that you can get closer to the vision, you can get closer to really truly engaging your families as an equal partner. And then these last two slides I'll just go through pretty quickly. We worked with, actually with Fiona a little bit to go through some surveys that we coded. We had sent, I don't know if you want to explain this.
Sure, yeah, so hi, this is Fiona Anderson at Illinois Action for Children. Yeah, so we, and I'll explain a little bit about the Family Engagement Subcommittee later, but one kind of actionable item that came out of that subcommittee was it would be interesting to send a survey to local early childhood community collaborations across the state to identify the ways they're engaging with families and what that looks like for them, and then what that impact has on their practice and their policy and their work. And so through that survey, we started to code the results into different categories of engagement with examples. I'm sure some of you maybe on the webinar had taken this survey, so some of your input is probably in here. So we coded them into the different levels of engagement for parents with the examples about how local collaborations can and are engaging with families. So this is our...
Yeah, and that's that. And then I think the innovation zones reflected this as well. And so we are putting together a toolkit which will be available hopefully by the end of the month, most likely by the middle of February, and it'll be on Partner Plan Act, but it's engaging families in enrollment, and then this is part of that. So, you know, where we think about how a family or individual can be engaged, it's really at all levels, wherever they can be at the given time of their experience. So sometimes at the individual level, you know, me as a parent, I can engage. Sometimes I can do that at the state level. So the idea is that if we want families' voices to be heard directly, we can get family voice from surveys, from interviews, from cafes, focus groups, parent kindergarten interviews. Families can help other families, so that connects with our door-to-door outreach, the parent ambassadors, the pop-up preschool, really having a conversation. You know, we think about even sometimes seeing as a reminder. So if school starts at different times in an apartment building, so some kids might go to Catholic schools, some kids might go to public schools. Catholic schools usually start about a week or 10 days earlier. You see that mom coming home with her school supplies, or you see the kids going out with a backpack. That's a nice reminder. So it's families helping other families. Oh, I saw this sale. You should know about this. And this is something that really just happens intuitively. This is something that happens all the time, with or without our help, but knowing that we can tap into that natural conversations, that social engagement that's already going to be happening. Families involved in deliberation for program work, so contributing to discussions, engaging my voice in executive meetings, in work groups, parent advisory councils, or even proposing solutions or informing processes. So again, that's a bit like the example I was sharing with you, St. Louis. And then families providing feedback directly to state systems. So they might be able to provide testimony in Springfield or at a Chicago committee, meeting one-on-one in groups with policymakers, or coordinating. So where a family fits in, where an individual, you know, family is equal partners, they could be anywhere. And really understanding that it's not a continuum, there's no right or wrong way, it's just understanding and knowing your audience, asking your families where they are, where they can engage, where I can get their voice right now. But knowing how important it is to get family voice at all stages of our program, policy, and practice work. Okay, the next slide. And this next slide really just briefly, so it just shows what some of the impacts were, and so this came out of the surveys that Fiona had put together. So when family voice is heard directly, more parent voices are contributing to the system, to a system scan. When you're thinking in a system way, they can tell you what's working or what's not working. You know, when parents are helping other parents, that's helping with completing applications, helping people understand more about developmental screening, helping parents even bring their children to school. So that really goes to some of the social capital model. Parents being involved in deliberation for problem solving. So, you know, with office hours were changed. I think this was in one of in the western part of the state, or in Stevenson County. The families actually contributed to the WIC office changing their hours. A 188 kids hotline was created in Elgin with seamless referral to 311 as a result of family input. And, you know, family voice and advocacy led to restoration of some childhood funding, and then also learning about home visiting from a state senator. So, and we share all that to say that there's a lot of work that we've learned, a lot of work that we're happy to share, and I'm actually going to turn it over to my colleague, Jill Bradley, who also through Race to the Top funding was able to learn and practice, and also through her years of expertise with the Awards of Excellence.
So once again, thank you for being on this call. I've had an opportunity through Awards of Excellence moving throughout the state of Illinois. Usually I was in Cook County, so this was a chance to really, okay, if it works, it should work throughout the state. And so I'm going to start at the end of the story, which is a flash to our toolkit that really we ended up having that developed over the course of time, but published toward the very end of the project. I don't know if people are aware that funding for the Award of Excellence for Family and Community Engagement actually ended December 31st, but the work goes on because this toolkit helps that the slide that says 7 standards of quality for family and community engagement, programs did not need an award to say that they wanted to improve it because their work with families and the communities that are evolving. And so the word of how to involve parents is one of the introductory comments in the toolkit because it really shakes up your head. And the way if I had a catchphrase, as Leah has shared with us, I think ours is family engagement is the new parent involvement. Parent involvement what used to mean signing in the sign-in sheets, coming to meetings. The meetings were at the convenience of the center. But family engagement meant that there was more opportunity to listen to parents, solicit their comments, solicit their input, be reflective, our programs being reflective of their needs, and to go even further that we could help to develop what new communities are, because communities are self-determined. It could be a small community. It could be a very dynamic block that wants to make sure that there's continuity of care from infancy through high school and college. Or it could mean, in my own personal community, they've changed the name of my community. And we used to be called the low end, and now we're Bronzeville. And it almost shines when we say it because it is self-declared. It means that more resources are coming in. So the Awards of Excellence is the shiny new name and process that helped programs to think about how they were going to involve parents in all different levels in their engagement with families, not just parents, and community. So I'm giving you the flash. This is the commercial. This actually, we have a new edition of this coming out even after, can you imagine? So December 31st, now we're ready with another edition already. So we're very, I mean, it's an evolving, dynamic process. So our next slide helps to remind what some of our opportunities and challenges have been. Over the course of the 2 years of working with the Awards of Excellence and Race to the Top, and as I say now, any program that wants to improve their family and community engagement is, the opportunities are that we met center-based programs, campus-based programs, hospital or medical-based, school districts of various sizes. So sometimes a school district, a principal was a principal of 2 different early childhood programs, and so she had the responsibility of meeting with families that were of a very different profile in the 2 different schools that she was managing. So even when I make the mention of school districts of various sizes, I say that to say sometimes the early childhood program was the small little fish in the big, big pond, or sometimes it was the representation of what this community is going to do for young children. So it was very important that the principal was on board and that she had an ear to the families that came into her program. And there was various capacity for implementing strong family and community engagement, because people thought they were doing it well already. The reason that they decided to do the Award of Excellence was because they thought they were going to get the award. So to find that they were at different places to begin with, and to realize there's further and further ways that you can reach to become excellent. The eventual use of a toolkit came as a response to hearing what programs needed. And all of these examples that we gave above, each one, as you can imagine, had a different need for help guide me through reaching for excellence. And in some cases, they were doing those tiny wins or small victories that Leah spoke about, because maybe it's just helping fathers to feel more comfortable in whatever engagement and activity we were inviting them to. Or one that we thought, the program that we thought in Peoria that was doing an excellent job with fathers, took this opportunity to say, you know what, if we're doing this, we could do even better. We know Home Depot has to do community outreach. We can help them with that. And so if they did special projects with our dads only, more the better. It was a mutually beneficial set of activities, and so the ones who were doing very well wanted to do even better, and the ones who weren't doing very much and had to admit they weren't doing very much had something to reach toward. And then the acknowledgement in the field that relationship-based approaches come in various forms. I remember several conversations about language being an issue. We say that we are culturally sensitive and that we do outreach so that there is real communication and meaningful communication with families and community, but sometimes translation is not enough. And who the face of your program is, what kind of hiring you do. Leah mentioned respectfully acknowledging the input that parents and family members provide. You wouldn't know who to contact if you didn't talk to and listen to the right parents. For instance, even about political, okay, not this alderman, that alderman. Okay, really, the alderman's not the right person. His dad is the right person. He tells him what to do. So if you can call up the dad, he'll tell the alderman that we need to have this thing done. So there were so many insights that we got in terms of relationship-based approaches. And you can't always, you can write it down, but we had to give good examples of it and acknowledge that you're showing us something that's not written in a book yet. And then finally, opportunities to collect data to improve program practices. We're good at collecting data, meaning that if somebody gives us a survey, we'll pass it out. If we get that critical number of returns, we're happy. If we give a report at the end to sometimes someone else, not the ones who filled out the survey, but someone else, whoever commissioned the survey is the one who gets what the results of the surveys are. So in developing our toolkit, it asks us the hard question of why are you asking these questions? What format are you using to gather data? And then what are you doing with it? And are you respectfully returning to the people who have given you the data, what is the outcome of gathering the data? And that came home to us several times. It was both a challenge and an opportunity. So if you'll do the next slide, I'm going to call just about all of these lessons learned. So the variety of our field of early childhood education, and even in the continuity, dealing with our teen parents sometimes, we understand some of the barriers teen and new moms have in being engaged in early childhood programming because their time still is not quite their own. And so I might help family engagement by helping that teen to be available for some of the resources that we've shown her are out there. So the variety of the field provides a variety of approaches to being supportive to families and programs in providing engagement with families and communities. That toolkit was a much needed resource, and that is we needed to have something in a place that people could reach to. So our next task will be to get the toolkit online, to provide opportunities to train the trainer so that programs can possess and own this, disengaging it from a awards journey means, do you really want to be well? Do you really want to improve? Do you really want to engage? Well, then, if there wasn't an award attached to it, how much effort would you be willing to go and examine 7 standards of quality? That community is often self-identified. I began with that as a caveat because you know, there were some rural areas that we visited that the child care center was the center of the community, that much was required in terms of community engagement of that early childhood program. And so when we met with the administrator, and it was a small district superintendent, and he came to our first meeting in a suit and tie, it kind of threw us off a little bit, like, what? But this was one of his jobs, and so he needed to figure out how will this fit, because he wanted to make sure that he did not take his community for granted because they demanded and needed so much from him. He was very in tune to knowing the need for being connected. So community is self-identified. It was a lesson learned for us, and we continue to learn that lesson. And the final one on this slide is we don't have to be afraid of softer forms of data to know that we are being responsive to families and community. So engagement that takes place in a hallway can sometimes result in you know, more expanded. Well, for instance, I'll give an example of a parent who wanted to complain about the parking lot being terrible, which the parking lot was terrible. So it was a hallway encounter, would have been a softer form of data collection, but I don't have to tell you the spin-off of, okay, well, let's see how other people feel about it. Let's see what the community can do to help us to raise funds to get that done. Okay, we won't be able to do the whole thing, but we can do the part that is the drive up for pickup for children. And the triumph of the families feeling that they had really made a difference and could see and point to a difference. And of course, that fueled, okay, now we're ready to build a highway. I mean, I'm exaggerating, but it gets to the point of softer forms of data collection are valid. One other quick one is that one of our administrators didn't have time to, she thought, to listen to what a parent had to say, and so she wrote a note on a colored piece of little sticky note, and that became the standard way of introducing a topic. It became the agenda gatherer, so that you don't have any more pink ones. And so she said, it doesn't have to be pink, it can be any color. No, when you see that pink one, you know a parent has made some input, a parent has said something, so we want you to know we've got something to say, and we're using a format that you recognize as this is a topic you better pay attention to. So we smile about it, but it is, you know, sometimes we are so high and mighty we don't get the message, and I want to encourage that we continue to have ears and eyes open. So face-to-face, written surveys, phone messages, emails. I've had screenshots of emails. Is this a good example of back and forth of moving a issue forward that ended up in an IEP, a child who needed special needs? And yes, I mean, of course the documentation has to conform eventually, but to acknowledge that softer forms are still gathering data. It's valid if it helps to get things going where you're going. I'll end with, there isn't a slide for this one, but to let you know that there is a self-assessment as a part of the toolkit. And so if a program only wanted to do that, if they only wanted to look at the various areas of engagement for both families and community and the wide range of opportunities there, and in the quiet of your own program with a small team, you can admit what's going well and what's not going well. And if you didn't do anything but that, that is also going to be available. And it's a part of the entire toolkit, but I would encourage that people think about using a self-assessment tool, and I think ours is the best. So I'll end it here.
And also noting that the toolkit will also be on Partner Plan Act.
Oh, right.
Okay, great. Thank you so much, Leah and Jill and Fiona. At this time, we would like to invite you, we'd like to open up the lines for those of you who would be interested on sharing any thoughts or asking the presenters any questions. So we will unmute everyone and feel free to ask a question. If you have audio issues, feel free to type your question in the chat box. Some questions to consider is who has used any of these approaches before? What worked for you? How did it inform your efforts? Are there additional ideas?
This is Jackie, and I was wondering if the pop-up, the pop-ups, preschools, if somebody would mind talking more about that. That was really interesting.
Sure, Jackie, this is Leah. Hi. Hi. I can tell you a little bit about the pop-up preschools in the sense that we had two that really took the lead on it. It was Cicero and Elgin. And what was interesting about it is that Elgin actually started it first through a different grant. And then when the Innovation Zone resources came to the communities, then Cicero went to Elgin and interviewed Elgin. And then when Elgin became an Innovation Zone, they went to Cicero and interviewed Cicero. Does that make sense? So I like to think of this as robotics, like in terms of how this stuff got invented. So one person has an idea, and then rather than starting from scratch, they went to another and then kept growing the concept. So all that to say, if you decide that you ever want to do a pop-up preschool, I would strongly encourage you to reach out to the Innovation Zones to get some ideas and really learn concretely from their lessons learned and the opportunities, and then what they did with what they learned and what they would do next. But really what it was kind of as a whole was a little sample of preschool. So maybe a parent stated that they weren't ready to do a whole day, or a spouse said, I'm not quite sure that I want my child to be gone for the whole day without me. So then the parent or caregiver or grandparent would say, okay, I can try this little thing. So Cicero looked at data and actually mapped out their community to see where there are what we would call a child care desert, so a space where there was nothing in walking distance to where families lived. From there, they built partnerships with faith-based, with a church, with a park district, with another site to then put a pop-up preschool at that location. They offered them at the same time, same day of the week, in 6 different, they sort of broke the area into 6 communities. And then they used creative curriculum, and then they had a regular running curriculum that would go on. And in that community, they partnered with their AOK network, and they also partnered with their McV. And so they had people, in addition to having teachers that they hired, they had parent ambassadors who went out around the community to let them know that the pop-up preschool was there. And then once families were at the pop-up preschool, the child would have the curriculum, and then the McV coordinated intake staff person would then meet that parent and do an assessment to figure out what other needs that they might have. From those needs, that AOK network person had been out in the community building relationships with healthcare providers, domestic violence, whatever other services might be there, and then they would connect the families to other supportive services, where the Innovation Zone would then connect the family to enrollment in an early learning program. So they really coordinated all of that together. So the pop-up preschool was one part of a strategy, but it was much more comprehensive than just recruiting families to come to a play and learn. It was a play and learn with a purpose, and that purpose was to get kids connected. And it was also really to build relationships. In Elgin, what they did is they actually had the partnership with the public housing program, and then they had, like I said, the summer food service program there. And then they just, same thing, same day every week, same time, for that consistency and predictability for the families. And then once they were there, they ran a curriculum and then really took time to engage the families, build a relationship, build the trust, answer questions, alleviate any concerns that they might have about enrolling in an early learning program.
That is just wonderful, and just such great ideas, and such a valuable resource for those two places for learning more and how to implement this. Thank you.
You're welcome. It was really creative. You know, it's for communities who would want to try something like that. It's not as, it depends on how you do the approach in terms of the resource intensiveness of it. So if you choose the model where you're bringing in the teachers yourself, that is resource intensive in terms of having to pay teachers and train teachers and have the staffing for that. But you could also do a partnership with a school district. And I know that in Cicero, you know, now that Race to the Top is done, that they've actually, I think they wrote for a grant and they did some shared resources so that they took a teacher from one of the child care programs, and then they're continuing to do the pop-up preschool in the community with the resources that they already have.
Great. Thank you for that question and for the example that you shared from Cicero and Elgin. If there are additional questions, feel free to enter them at the chat box at this time. Just to the time that we have left, we're going to transition to offer you some additional resources. And I'd like to invite Fiona, who's also from Illinois Action for Children, to share what her insights and role has been in supporting this work. Fiona?
Thanks, Linda. So hi, everyone. I'm going to share a little bit about the Family Engagement Subcommittee of the Early Learning Council. So this group started about 1.5 years ago and is a result of some parents who are interested in being part of more of our committees and kind of provider-focused structures that we have. We meet a lot with each other at different tables, but sometimes parents aren't always included in those meetings or they're not always accessible. So this is a subcommittee of the Access Committee of the Early Learning Council, and our objective is to identify best practices and protocols around authentic family engagement. And then the outcome of this committee will be to submit recommendations to the Early Learning Council on how to create an intentional system to include family voice and input to improve policies and systems. So you can go to the next slide. So some of the family engagement models we've reviewed, one slide back, and sorry, there's a typo. So we've looked at a lot of family engagement models in our state, in the city, in local collaborations, and then in the country to try and identify what those best practices are, what works for parents, what works for providers, what works for families, in order to include voice at all levels, both in programs, in practice, and then in policy. So I've listed some of the models we've looked at. They're not all. EverThrive has a model based on the Title V program, so that's health focused, but they are getting input from parents and incorporating it to IDPH, the Illinois Department of Public Health, in order to think about how they can adapt some of their programs to better meet their needs. There's Kofi Power Pack has a parent empowerment model. The Minnesota Department of Education, Michigan, Head Start here in Illinois is the Illinois State Board of Education. There's a group in Boston, Boston Thrive in 5, Washington, Parent Leadership Institute. And then we also, as Leah mentioned earlier, the early childhood collaborations in Illinois. We wanted to find out what was currently happening so we could incorporate some of the best practices and lessons learned in our recommendations. So this group, we're focused, we are kind of wrapping up and starting to create our recommendations, and we have 3 areas for recommendations that we're trying to tailor what we've learned. So we're hoping to make recommendations around family engagement principles, around program and community collaboration. So this would be how can the Early Learning Council incorporate the work of community collaborations and local parent voice and family voice into the structure that exists now, or what would the structure look like to include them, and then recommendations at the state level, and then the Early Learning Council around communication back to families and parents who aren't necessarily part of the statewide structure. So we have a meeting coming up tomorrow, April 26th from 10 a.m. to noon. We meet in Aurora and in Greater East St. Louis at the same time so we can get representation from across the state. So this is where we're going to begin to review the evidence and the models we have now and determine what should move forward in our recommendation. So we'll meet 2 or 3 more times as we create our recommendations, and then we'll share them with the Early Learning Council for feedback and review and see what they can incorporate. So if anyone is interested in learning more about this group or being on an email list or seeing any of kind of the documents we've created, Edna's shared on the side of your panel 2 handouts. So we did a summary table of the family engagement models. It's available in English and Spanish. So if anyone is interested in learning any more about those models, we have a nice little snapshot about the ways other states, other programs engage families. You can use those there. And then if anyone is interested in joining the subcommittee or learning more about it, you can email Edna and she'll connect you to me. And that's
Great. Thank you, Fiona, and to all of our presenters for your insights and resources. It's a topic that is always very popular, and communities really want to continue to build their strategies and practices, and so we really appreciate you sharing your insights. At this time, we would just like to share some of our upcoming events. On May 23rd, we have another webinar highlighting strategies where early childhood and school districts have been connecting to support community efforts. On Tuesday, May 9th, you're invited to partner up. We're partnering up with the Ounce to go and advocate in Springfield. On June 13th, which will be the Partner PINAC Conference in Bloomington. Collaboration leaders, early childhood stakeholders are invited to come together and continue to build our skills in supporting this work. And lastly, on June 22nd, you're also invited to hear sort of our wrap-up session, a wrap-up legislative session, and identify what additional policy issues have been resolved or continue to move forward at our statewide policy caucus in Normal. At this time, we would like to invite you, as we check out of the webinar, to please, on a scale of 1 to 5, share how valuable your participation was in today's webinar. The poll is now open, so if folks can please submit your answer. We'd appreciate it, and we'll show it at the end. Thanks for everybody's participation today. Just a plug that we'd like to make sure to thank you for your time and your input. This project was made possible through the generous support of the Grand Victoria Foundation, and this concludes our webinar. Thank you so much for your help and support, and we look forward to seeing you next month. Bye-bye.